Dr. Gary Bellman. I'm going to discuss the various formulations or options of testosterone replacement, from injections to pellets to oral to long-acting injections, and discuss what I think is optimal. So testosterone goes from 250 to 1100 as normal ranges. And I'm personally of the belief that men feel and perform better at a testosterone 800 or 900 versus 400 or 500. So that's the starting point. The goal of testosterone replacement, in my opinion, is to be effective and to be cost effective. So when we put someone on testosterone, he may be on testosterone for 30 years. So he doesn't want to be busy paying a lot of money for various formulations. And it wants to be effective and doesn't want to be busy with prior authorizations and therefore avoid formulations generally that big pharma make. So when I got interested 20 plus years in testosterone replacement, I said, why should you do injections? Do topicals, patches, creams. And it turns out that as far as the criteria, topical testosterone wasn't as effective. In the range of 250 to 1100, topicals brought men up to 500, 400, sometimes 600. And it wasn't as effective as the injections or the pellets. And there was the cost, and some of the products needed prior authorizations, and then there was a risk of transference with the topical to children or women. Do I have patients on topical testosterone that are happy? Yes. Do I think it's optimal? No. Let's move on to Jantesa, oral testosterone. They came out with an oral testosterone. Is that optimal? Well, is it effective? Is it cost effective? This is from the website, and you may see that the dosing and the results, the testosterone levels, are about mid-range, about 500 with the products, and therefore not as effective as bringing it up to 800 or 900. And it is expensive. It requires prior authorization. So as far as oral testosterone, they claim, well, it doesn't have all the side effects of testosterone injections, doesn't have the atrophy and the fertility issues. Well, yes, but it's not as effective. So if you're going to do testosterone replacement, do it in an effective manner. Oral testosterone, as far as I'm concerned, is not nearly as effective as injections or pellets. So they came out with a long-acting injectable, Zyostat. Let's discuss that. Is that better than short-acting testosterone injections? Well, if you look at the website, the results are, as far as the range, the testosterone levels and results are around 500. Similar to gels, similar to oral testosterone, long-acting injectables. They don't meet the criteria as far as effectiveness and cost effective. When big pharma gets involved, it requires prior authorizations, can be costly. Sometimes some insurances cover it, some don't. You require a doctor's office to do the prior authorization. So when it comes down to effective and cost effective, basically you have testosterone. We use cypionate, you can enanthate, but testosterone, big pharma hasn't gotten involved in injections. Once a week, twice a week, it's inexpensive and it's good for long term. If you want to pay a little extra money for testosterone, these little pellets, tiny little pellets we place under the skin, and as effective as injections. However, there's an extra cost. So when you're looking at the different formulations of testosterone, you want it to be, again, effective and cost effective. You could be on this for many years. You don't want to be busy with prior authorizations and paying a lot out of money. So in my opinion, the optimal form of testosterone replacement is injections. If you want the convenience of not doing injections, consider pellets.